And finally, speaking of testing and lab results, we acknowledge and recognize that there is a challenge statewide, nationwide, with respect to accessing testing. We've heard that from you. We've seen it in our own numbers, and Commissioner Wambrew and I are taking steps to address it. For example, we're working with the manufacturers of rapid tests to acquire as many of those tests as possible for the state of Maine. We're also working with pharmacies across the state to see how and where they can expand the number of locations that are offering testing, as well as the number of hours per day that each location can offer testing. We're also making more COVID testing available in high traffic areas, like at the Portland Jetport. This strain on testing availability is being driven by two things: supply and demand. On the supply side, the companies that make the tests that we use are ramping up their production to churn out as many tests as possible. But right now, supply remains a concern. On the demand side, things like healthcare facility outbreaks, which, as I mentioned, are 19 of our 33 outbreaks. Healthcare facility outbreaks mean and require frequent, repeated, large-scale universal testing of staff and residents. That frequent, repeated, large-scale universal testing means that many of the laboratories in the state right now are focused on responding to outbreak testing. We absolutely hear you and understand that we need more testing in the state. We are working and committed to making that happen by undertaking the steps that I outlined. As we make progress there, I will continue to provide updates. With that,